My name is Tanaka. I'm a mental health clinical nurse.
This is Nicolle Mapiye, and I'm a health and safety consultant, and you're watching The Professional Lounge.
Growing up, I never thought I would become a mental health nurse. First, I was an accountant, then I decided to change to mental health nursing. I never thought I would be dealing with brain chemistry or suicide prevention or psychosis or some mood disorders. So my journey started with a lot of placements or rotations. I had to do more than 800 hours of unpaid rotations in different areas of nursing. So I did, aged care, I did surgical wards, I did theater, I also did just medical wards as well. When I ended up going to mental health placements, it was quite a shock for me. Just coming into a ward, seeing people saying they're hearing voices, the voices are talking to them, and people just saying they're seeing things which no one else was seeing, which is visual hallucinations. And that was quite an eye-opening for me to actually realize that there is something called schizophrenia. There's also something called bipolar and some other mood disorders. So there was a lot of learning and a lot of adjusting to the environment itself, which made me sort of like decide that I wanted to do mental health. Your family members can have a depressive episode and they don't realize that they're actually suffering from depression. So that was a turning point for me to see that anyone can be affected with mental health, and it's something which is good to help even your family members when they're going through a rough patch. So when it comes to mental health in the community, there's a lot of stigma. Even when you're talking amongst your friends might pass comments like, you deal with crazy people and you might end up being crazy yourself. Even in the community, when you go out to the community visits, you have to go out without wearing uniforms because there is a lot of stigma when people see a mental health nurse going to a certain house. People will be like, why are they visiting that person? So you actually have to go dressed in casual clothing. But there's ways of, bringing change to sort of like tell people about mental health more, that it can affect everyone. That sort of like brings the stigma down. But stigma is always going to be there because it's not, it's a challenging environment dealing with someone who is psychotic or someone who is having a depressive episode. As a mental health nurse on a day-to-day sort of like basis, I'll start by when I was working on the ward, like an inpatient ward. On the inpatient ward, you allocated your patients which you're looking after for the day. So you go and greet them to see how they slept or if they need anything to be done on the day. Then you move on to give them some medications, some scheduled medications. And also some of the patients might have some time off the wards, which we call leave, and then you have to sign them out, sign them back in when they come back. That's the inpatient side. But mainly these days I work in the emergency department where I actually do mental health assessments. So I'm on the other side now of mental health where you assess the patient before you admit them to the ward. So part of my role is I go and do an assessment. An assessment can take 45 minutes to 1 hour. So you're basically looking at the presenting factors why someone is coming to hospital, and you're looking at the mental state. So some people may come to hospital drug affected, but the time you see them, maybe they're no longer hallucinating. So then you have to get collateral from the family to see how often is this thing happening where someone is actually hallucinating. Are they only hallucinating when they're affected by drugs, or they're actually hallucinating because maybe they're not taking their medications and they've got maybe a well-known diagnosis maybe of schizophrenia. So if someone is off medications for a long time, the psychosis is going to come back and they'll need to be back on medications. Some of the medications which can be used, tablets or some depots, which is a form of injection, which can be given every 2 weeks, 4 weeks, or every 3 months. There's a lot of men who suffer in silence and they end up having a lot of depression, and they end up trying other things like substances, a lot of alcohol, a lot of drug abuse, whether that's marijuana, methamphetamine, crystal meth, anything you can think of, to try and suppress how they're feeling. So if you look at the statistics worldwide, there's a lot of suicide amongst men because we don't express how we're feeling. And you find that even the rate of suicide, men always tend to choose the most lethal way. So they usually go for the most lethal way, and they end up actually dying by suicide. Whereas women, their rates are quite low because women will share a lot about how they're feeling. They can spend even 1 hour conversation with a friend, and which is good for your mental health. And I think for men, there's a lot of lack or a lot of gap where there's need for men to have a lot of men's group, a lot of gatherings, and a lot of just opening up. This can be done better in a form of activity. If people go and play golf or play soccer, they might end up opening up more than just having a one-on-one session. We find there's a lot of men who present to, even to emergency department. You give them some therapy, free therapy, or counseling sessions which are available. They'll take the piece of paper, but they never follow through. But if you give it to a lot of, like most women, they follow through. They'll go and see a counselor. And they will they will sacrifice to pay and see a counselor. So there's a lot of gap amongst men when it comes to mental health, and we should advocate more for men out there so that the rates of suicide might reduce. So when it comes to mental health, we can pretty much group them into two. There's the psychosis element and there's the mood disorder element. So there's some diagnoses which fall under psychosis, such as schizophrenia. And so when it comes to schizophrenia, it can be treated with antipsychotics. Antipsychotics will come in the form of tablets or injections, which are depots. These are long-acting medications. Mainly people who go on depots are people who are non-compliant with tablets, so you have to put them on a depot, and they have to actually come to the clinic or actually go to their houses and give them the depot. So the main causes of, let's use example of schizophrenia, can be genetics. So genetics, if someone's, let's say, grandfather or father had schizophrenia, the high chances that that person also has schizophrenia. And the other component is substance abuse. So if someone is using a lot of substances, they'll end up developing what we call drug-induced psychosis. When it comes to drug-induced psychosis, it can be resolved usually after 3 days for most people. If it's not resolved, then after 3 days, then someone will actually have drug-induced psychosis. And sometimes the other causes are infection. If you get infection in your brain, some STIs can travel up the brain, then you have psychosis. And when you're talking of psychosis, that's when it affects all your 5 senses. So your sense of sight, you start having visual hallucinations, you start hearing voices, which is auditory hallucinations, and some people will start to have, they'll feel like they're tasting something in their mouth which is not there. So there's tactile hallucinations, and there's also, people will start to smell gases which are not there. Olfactory hallucinations. So it affects all your 5 senses basically when it comes to psychosis. Yes, it can be treatable, but if you continue the habit of, for example, taking substances, you continue having this drug-induced psychosis until you have, permanent things such as schizophrenia, where you're mostly hearing voices or having visual hallucinations. So that's the main causes of psychosis. And then when it comes to mood disorders, this is when you have things like bipolar or sometimes like generalized anxiety disorder. Sometimes you've got people who've got sort of like narcissistic personalities, so it affects even your personality as well. So the things which can be used mainly to help with mood disorders are mood stabilizers. So some of the examples of mood stabilizers will include things like, sodium valproate or lithium. Some people who prefer lithium over sodium valproate, but they all sort of like work as mood stabilizers to stabilize the mood. You find there's more psychosis in men and more mood disorders in women, but sometimes you can get also, men with bipolar or women with bipolar, but it's just sometimes lifestyles. A lot of substances tends to be more to men. That's when you find a lot of drug-induced psychosis, mainly to men. But yeah, so it can be treated using either antipsychotics or mood stabilizers. And some people have a normal life, even if they've got bipolar, they can actually be on mood stabilizers, have a good job, become a parent, and function like any normal person would function in society. So just because you've got a mental health disorder doesn't mean that you can't function in society. But some people, they can't function in society because it's now at the end stages or severe cases where someone can't even go to work without hearing voices and they can't concentrate. But yes, mental health can be treated. So when it comes to mental health, it doesn't just affect, older people, adults. It also affects, children. I've seen, young children as young as 8 or 9, committing suicide or also having a lot of challenging behaviors as well in school, where they're actually expelled and they can't actually go to school. So when it comes to kids who have got a lot of challenging behaviors or some mental health issues, this can be just from a traumatic upbringing as well. You can contribute to that. And some of the things which does help in terms of helping these kids is, linking them to, the good thing with technology these days, you can link them to apps where they can do some sensory activities, or sometimes you can just tell them that when they're feeling angry, they can just go and, have a nice cold shower or warm shower, which can help them in regulating their emotions. So a lot of kids, it's about helping them to regulate their emotions and also thinking that, biologically they're actually growing up and they're struggling with dealing with emotions. And if the family environment is not good, it doesn't help as well to make it worse.
So growing up, I grew up in a large family. I had 5 other brothers and sisters, actually 1 brother and 4 sisters. And my father was a lawyer and my mother was a teacher back then. I think growing up, I wanted to be 2 things. I wanted to be a teacher or a lawyer, because I remember also being picked up from school and going to my dad's office and, just watching him finish off the day and seeing his clients, watching people come in and, go out and seeing him wear his robes to go to court. And it was just another world that I hadn't been exposed to at school or at home. In my role as a health and safety consultant, I came across an incident that I had to investigate. And until that point, all the other incidents that I had investigated were not as serious or near fatal. And the one that I had to investigate now was a near fatal incident. It was a life-changing incident for one of our employees. So what actually happened was it was during a construction for a major bridge in the city, and a 600-kilo metal beam, fell on the legs and torso of one of the employees. And when I had to investigate that incident, it wasn't just work. I started to see it as, someone's life had been changed, and I had to do a thorough investigation to make sure that that employee got closure of what happened, what caused the incident, and the family would get any justice that was due to them, and also we would prevent such an incident from happening again. And it was a very emotional incident to investigate, talking to all the employees who were present at the site, getting their witness statements and doing the report. I felt like it really brought 2 worlds together of reality and work, and it made me see how important my job was and how seriously I have to take it, because ultimately it affected how someone was going to get compensated, how they're going to live their lives, and how other people on the site were going to be safe. the health and safety industry is a male-dominated industry. And when I got into the industry, I was young. I was in my second year of university when I started working in health and safety. So I was young and I was African, and I looked very different from everyone in the office. I looked very different from everyone on site. And I remember having to go, I worked in field services, which was the people who laid the roads, people who maintain the city gardens, and they wear high-vis clothing, big boots, helmets. And I went in there as a very small 20-something-year-old straight out of uni. And I had to, tell them about health and safety, and I actually had to lead a training session on health and safety. And I remember everyone just looking at me, and I went into that training room to deliver the training. And I remember these big men, big in size, and they all were white Australians, and they all sat at the back. There were no people sitting in the front seats, and they were just looking at me with so much doubt. What do you know about the work that we do, and what can you tell us about safety? We've been here for decades. And I remember just trembling, just looking at them. I had my notes. I was confident. I knew what I was talking about, but I was not confident to talk to the audience that I had. So I quickly realized that with health and safety, it's not all about knowing what you're talking about. It's about knowing who you're talking to and speaking their language and breaking the ice. So it's no good just going in there and delivering training, for example, or conducting an audit. You have to go and build relationships and build rapport. And once you are human, it doesn't matter your skin color or any other diverse aspects that you have. If you go into an environment and you respect the job that people do, and you ask questions knowing that you are an outsider and they are the technical experts, they will, be able to open up to you, and it builds really good rapport. And once you have that, you are then able to talk about your area of expertise and get better results. What I've realized when it comes to finding the right career for you, after now being in my career for 14 years and being happy in my career, is you have to see how you can bring yourself to the job and not what the job can bring to you. You have to understand yourself and you understand your strengths. And for me, I know I'm a very structured person. I'm a very systems thinker. So the career that I had to go into was something that allows me to exercise that structure and that systems thinking. And workplace health and safety is all about management systems. So I'm really in my element when I'm in workplace health and safety. So I took the things that I knew I loved, the things that I know I can do pretty well, and I know that I can translate them to different roles. So I look for roles that have those aspects that align with my strengths. And once you do that, then you can be happy in your career, because in most careers, confidence comes from competence. So if you do something that you know you'll be competent in, you would do it confidently, and that will lead to a fulfilling career. So the first step is really understanding yourself, understanding your strengths, understanding what you love. Even ask the people around you, what do they think you're good at? What have you always been good at? And it could be a special skill, or the way you analyze things, the way you look at things. Look at the type of movies that you like to watch. What kind of movies are those? They can also highlight your strengths, the conversations you like to have, the books you like to read. So all those things are very good indicators of the perfect career path for you.